American Eagle Instruments has a new line of 7 instruments called the ProThin series, and for this video I want to show you the 4 that are designed for the periodontally involved patient. So we have the Gracey 1-2 and the 7-8, which are generally for the anterior teeth, and the 13, 14, 15, 16, which are for posterior teeth. Now the Gracey 1-2 is for those areas where a longer shank is necessary when the clinical attachment loss is present due to recession or pocketing. With a horizontal stroke, you can also easily access shallow furcations like so. The Gracey 7-8 can be used in all of the areas that you would use a 1-2, with the addition of the premolar areas as well. This is because of the slight design differences of the 7-8, which are that it has a longer shank with a greater angle, as you can see here. The 15-16 is used in the same areas as the traditional 11-12, which are for the straight buccal, lingual, and mesial surfaces. The main difference in the 15-16 is that it has a greater shank angulation that allows for easier adaptations for working on those areas. The 13-14, of course, is for access starting at the distal line angles into the distals of the posterior teeth. Now you may be asking, why was the 15-16 chosen instead of the traditional 11-12? So the cool history here is that the 11-12 was created when we stood to deliver treatment and patients were sitting a little bit more upright, and the 15-16 has since been designed for when the patient is in a reclined position. So this makes it easier to adapt and roll the instrument into the mesials of the molars. Also, sometimes, like in this example, we find those narrow pockets with our probes but only have a traditional bulky hand instrument to attempt access. So the XP non-sharpened technology allowed them to create a thinner working end with these ProThin Graceys, which allows us greater ability to access those more challenging areas.